Yo, what's up YouTube? It's your boy Bobby D, back again with another hot, juicy video. And as always, I'm joined by the man, the myth, the legend, the GOAT, Steve Cook here in Austin, Texas.
Bobby, thanks for having me back. I don't know about all that, but I'm always happy to see you and happy to help.
I really appreciate it. Steve's been a great help to me over the last couple of years in my hair loss journey. And guys, recently, just had my hair transplant. It's been 14 days now. I feel great. Off the pain medication and everything, just ready to get back out there and go back to working out and living my life. So what should I be expecting now, Steve, that I, got my stitches out and just healing?
Yeah, so, obviously today is a huge relief with the suture coming out. For those of you that do choose FUT, which is an excellent procedure for all the reasons we talk about on our other videos, the sutures, the difference between FUE and FUT in regards to post-op healing is that it's tight. And it just feels like your body wants those sutures out. So you must be feeling like a new man today, right? It's kind of like, you got to go to the bathroom when you're a little kid and you're like 6 hours to the next rest stop and then you're finally there and you're like, oh my God. That's kind of what it's like. It feels so good to have the suture out. So now that we have the suture out, what do we have to look forward to? Well, you did a great job. All the scabs are gone. Your skin looks great. You don't have any redness or anything like that. So now it's just a matter of a waiting game. It's probably the hardest part of a hair transplant, other than paying for it, is waiting for it to grow. So what are we looking forward to? Well, Bobby, this is going to come new to you even on this video today because we don't rehearse these things. And, you had that phenomenal first procedure with Dr. McGrath about 1.5 years, 2 years ago. You look fantastic. And, we've got comb throughs on the YouTube channel and all that stuff. And now you got a little greedy. You wanted to go for round number 2. I told you not to do it, but I'll say that. And I thought you looked fantastic. So you want a little bit more hair. That's okay. So in the hairline is what you're really going to see. Kind of like the first procedure, you're going to see that first. So those are where the tiny little single-haired follicular units are used to make that real natural look and angle and direction in a 3-dimensional space. Those are going to come in first, and you're going to probably see those coming in. And that's going to take about the typical 4 to 5 months. For some reason, the second procedure, maybe it's scar tissue or whatnot, seems to take a little bit longer. So for those of you out there that have had a procedure, looking to have a second procedure, this is what you could expect. It's going to take a little bit longer. Try not to compare the healing and the growth in the first procedure versus the second procedure. Have an open mind like it's a brand new procedure. Like we talked about before, and we'll talk about it again, the center core mid-scalp where we put a bunch of grafts up there, that's not going to be easy to see at all. That's kind of like, you moved into a new neighborhood, it's a new subdivision, and you've got no grass and they didn't give you any sod, so you got to seed it. Well, as soon as the grass starts coming up, you can see the grass. Now you've done a pretty good job over 2 years and you got a decent lawn, you got a bunch of grass, but you want it thicker, so you put some more grass seed out there. It's kind of tough to see the difference now. Okay, that's kind of what's going to happen with you. So what I would advise anyone that gets a second procedure, of course, make sure that your clinic that you're visiting does really good follow-up work, because you want to be able to compare in a controlled environment. Not too easy to see on your own. It's like watching paint dry in your living room for a year. So you come in at your 4-month, you come in at your 8-month, and then of course you come in at your 12-month. The result from procedure 0 to 1 is tremendous for most all patients, obviously, if it was done properly. The result from a first procedure to a second procedure is not as celebratory, okay? And it's because I love to bring expectations into this. So, but keep in mind, you have already had this done once. You know what the results are going to be. You had about 1,700 grafts. If you multiply that by 2.5 hairs, you're looking at another 4,000 hairs. That's going to make a difference, okay? So, stay on the preventative treatments so you make sure that you're not losing hair while you're gaining hair. That's not comfortable for anybody. And let the chips fall where they may. You're going to be great. You're going to be fine. But it is more of a challenge to see that change now that you've got hair in all those zones.
Yeah, for sure. I'm just looking forward to it, Steve. I'm counting. Because I remember last time, I think it was like 4 months was when I started seeing the new hair grow at the first time. So hopefully around Christmas time or something, I'll have some more density. So. And guys, I'm going to keep y'all posted on that as well, so stay tuned. And, thanks, Steve, again, for always being generous of your time and being on my channel. And stay tuned for some more hair-related content coming your way.